Yes, definitely. Another concept required.
I'm back, your host. As of today, we are doing colostomy care. So colostomy care is a procedure which is done mostly on the surgical wards. But before we go into the nitty-gritties of what the procedure is all about, let's look at the patient first. I haven't yet started in terms of greeting the patient and also talking to the patient. Okay, so So if you look at what we're talking about, you can look at now the types of colostomy that we have around here. So we can remove the colostomy bag. Okay, remove it. Then we look at this patient. This is an abdomen. So this abdomen, if we look at it, if you go back to anatomy, we've got the ascending colony, then the transverse colony, and the descending colony. So a tracheostomy can be decided which side an operation should be done. So it can either be done on the ascending colony, the transverse colony, the descending colony, or the sigmoid colony. So it can be done on those sides. So in this case, our patient, Mr. Mwila, has a colostomy here on the descending colony. So this is what we're going to care about. Okay, so our care will be focused here because this is where the colostomy is. So those are the parts of the colony, and that's where you are supposed to focus your attention. So in this case, he has it on the descending colony. So he has a colostomy bag. So then if you look at your procedure manuals, they have the two types. You can either do it on the colostomy which is active or a colostomy which is inactive. So in our case, this colostomy is inactive. So then what's the difference? If a colostomy is active, meaning fecal matter is coming out. So when fecal matter is coming out, it means that that colostomy, the care we're going to give is about clean procedure. So then if the colostomy is not active, like in Mr. Mwila's case, it's supposed to be a sterile procedure. So those two differences should be borne in mind. So let's look at our trolley. So our trolley, the setup is a sterile procedure because Mr. Mwila's colostomy is inactive. So that's why this procedure is sterile. So he has just come back from theatre. So then, for you, maybe new graduates or those who are doing training maybe in first year or second year, what could be the indications for the colostomy to be performed? So you look at procedures such as diverticulitis, intestinal obstruction, or colitis, or you can look at Crohn's disease, such intestinal problems. You can perform a colostomy. So it can either also be temporal or permanent. So a temporal colostomy, it is one whereby anastomosis will be done later after the disease has healed. But a permanent colostomy, it has to be with the patient the entire life. So they will be taught on how to be changing the bag for the time they want to change. So now let's introduce the trolley. We've got the top shelf and the bottom shelf. So we start with the top shelf. So on the top shelf, we've got hand drying flannel or drape. You can call it a flannel or towel or drape. Then we've got a ball of gauze and cotton balls. Then these balls will be used for cleaning. Then we've got a pair of sterile gloves. Then on the receiver here, we've got a gallipot. This is where we'll pour our solution. And in this case, the solution we are using is cool boiled water. Then we've got an artery forceps there. That artery forceps, that one is for removing the bag there because you're going to be gloved up, you're going to be in that sterile region and mood and all that. So you don't need to touch something dirty, you need a forceps to remove it. Then we have a window drape, which is here. This window drape is going to be used to drape as we do this procedure because it's considered a sterile procedure. Then we come to the bottom shelf. The bottom shelf, we have cook boiled water. Cook boiled water, this is the solution that we're going to use to clean the colostomy. Even at home, if patients are discharged, we advise them to use cook boiled water because it's very expensive to have normal saline at home. So you just tell them to buy, to boil water, not to buy normal saline. Then we have a new colostomy bag. It's on the bottom shelf because it is not sterile. So after you're done with cleaning, then you have to at least tell that assistant who's nearby to give you the bag so that you check. Then we've got Vaseline gauze. Vaseline gauze also is on the bottom shelf because it is not sterile. So we're going to put Vaseline gauze after you clean. So we're going to see how we're going to put it. Then we've got, this is an incontinence sheet. So it will be put underneath the patient's buttocks, or patient's back, so that you don't soil the linen as you clean. Then we've got a receiver. This receiver contains examination gloves. So examination gloves can be worn if you want to examine the area because you don't want to touch the linen in case it's soiled. Then we have the bowl. This bowl receives the drapes or the hand towels after use. We have a big receiver. This big receiver is for discarding the swabs and the gloves after use. Okay? No need of discarding your gloves or your swabs on the floor. You just discard them on this big receiver. So this is our setup and we are ready to go. So first things first, when starting the procedure in case of OSC, this is only 5 minutes only. So try to be as quick as possible. So there are those basic skills that you have to learn as you do. And those basic skills that you need to know are that you need to visit the hand washing facility. You need to visit it. You wash the first time. Then after that, you need to at least make sure that you go to the patient and do the A up to Z, the things we do. Greet, introduce yourself, okay? All those things and assess. Then another basic thing is that you need to ensure that your trolley is set. Of which in OSC, the trolley is already set for you. And then what you need to do is just to see the extra things that you should set. For example, we also set cook boiled water and all those things down there. We have to make sure that they are set. Okay. So you can come closer, don't be too far. Okay, that part will be short anyway. So then you need to ensure that everything is set. Okay, that's what we do. So as of now, since this procedure involves scrubbing, it's a sterile procedure, I need to ensure that my sleeves are folded before I start, so that I don't waste time when it comes to scrubbing. Because scrubbing will take time as well if you don't fold in advance. So if you have a jersey on, ensure that that jersey is taken out, or it's folded, or you just put it off. Okay, so let's have the hand washing. So the hand washing for us cannot being assessed for and washing procedure. So what we do, we just have a touch of water to show that you know that you're supposed to wash hands. So you have to just go there quickly, then come and do that, show the examiner that you're supposed to wash hands, and then do that, dry, then move to the patient. So Mr. Miller here, up to greet. Good afternoon, Mr. Miller. Okay, good afternoon. Mr. Miller, I am Silwamba Collins. I've come to bring your colostomy. So, can I please check how it's looking? I said yes. So then I have to just have a look. So, before I touch it, Mr. Miller, are you going to allow me to go on with the procedure and clean it? I said yes. Okay, so let me just leave it exposed for a minute, then I come back. Okay. So at this moment I've got permission already and it's exposed. I'm avoiding to don gloves because the moment I don gloves, it means that I have to go and wash. Okay, so that's why I've avoided to touch the colostomy bag because I don't want to go and wash hands. So the reason is simple, I want to touch cook boiled water. Okay, that's why I avoided wearing gloves. So in OSC, you have to use strategy. It's all about strategy in OSC. Your don gloves, you have to wash hands. So now I've poured normal saline, cold water, which is the solution there. So at this moment, I can go back as I promised Mr. Mwila to say I will come back. Then I can don gloves. I can don gloves at this moment. So these are examination gloves, they're not sterile gloves. Okay? Then I can go back. Since I promised I'll be back, I have to go back. And then place the incontinence sheet under. Okay? So Mr. Mwila, let me just place it under. Okay? So Mr. Mwila has allowed me. So that incontinence sheet is gone down. Gone down. Then the next thing, why the gloves are done, because I want to loosen up. So I have to loosen it up so that it's easy for me to remove it with the forceps. So it's loosened up all around. Okay, so Mr. Mwila, now let me just go and scrub so that I come and do the cleaning. So at this moment, the way I said strategy in OSC, you remove your gloves like that, inside out, and discard them there. So instead of washing hands 3 times, it's only twice. Before starting the procedure and when scrubbing. So the scrubbing technique, as usual, in OSC stands, but you know, when it's scrubbing for 5 minutes, it's different. So we're looking at OSC and then you scrub. So this is how we're going to scrub. 1, 2, you come out, then you come like that, then just that, then 1, 2, 3, 4, you're done. 1, 2, 3, 4, you're done. Then you go 1, then you go 2, then assistant to close. So you come. So if you do practice, meaning this procedure will be done quickly. So if you notice the way I washed or the way I scrubbed, it was something that was brisk and it was just quick. So just have to practice so that you get acquainted with the procedure. It's easy to scrub, as you saw. Then the technique for hand drying, it still remains. If you refer to our previous presentations on scrubbing, you find that same. There are 4 corners, so you have to follow the corners. So 1 from the fingertips. We start. Okay. Then 2 goes. Okay. That. Then the same goes round and round and round and round. Okay. So then my 1 was this side. 2, then 3 is there. So I have to go to the 3rd one, which is here. Then like that. Then number 4 is here. So at the back of your hand, like that. Then you go round and round and round and round. Then now it comes to this part of throwing. Students will throw just on the floor and do that. But then the boys there, just ensure that you fold it like that, then you discard. Okay? At this moment, after drying, I have to don gloves. Okay, so you open that. Okay, so you may find gloves like these. Sometimes they are not nicely put. So just get there and identify, because these were not nicely put, as you can see. So identify the thumb and go in like that. Okay, just ensure that you practice the technique for donning of gloves, so that things are easy for you. And there, and there. Okay, so do that. Okay, and then this part, you just grab it there and do that, and then discard. Okay, so at this moment, I have to get this faucet. But then if you go to your procedure manual, it says when cleaning the colostomy, you use faucets. But then sometimes you can find that you're injuring the patient because you won't know the force that you're applying there when you use the faucet. So it's better to use your hands so that you know the force that you're applying. That's why we're not using forceps. But in your procedure manuals, it may have to say use forceps, but you're using hands, okay? So this forceps will be used in this manner. So this is how you go. You go, then you get it like that. Since you loosen it up, then you drop it there, okay? Then the forceps. then you get only this part here. Okay, so this is how you get it. Then the rest you throw. Then you fold this like that. and place it round and round the stomach like that. So this is how you place Vaseline gauze. You place it round the stomach, okay, like that. So after having placed it round, because when you put the bag here, the colostomy bag, you find that it will be coming out because glue and Vaseline or petroleum cannot stick. So that's why you have to get this gauze, because glue and Vaseline will not stick together. So you get this gauze, which is dry, and place it round the stomach. Okay. So you place it round, then my assistant can now bring the bag. So at this moment, I can even remove this part so that I place the bag nicely. So, sorry, just my assistant has to peel it off nicely. So you have to peel it off like that. You have to peel, okay? Yes, then you discard that. Another part you're supposed to peel is here. So you should peel. Okay. Then after having given this, you're supposed to just poke it. You poke it like that. Okay? You just poke it like that and pull. Or some people just get and do that from this other side. Okay, but then it won't, you can't see it through, so I need to just do that so that you have this part here. Need to pull it. Then since the drainage should be going this other side, you have to place it like this. Okay, so this circle here, or this hole here, is supposed to be there. So you put it there, round, and then place it like that and start sticking this part. You stick like that. Again you turn, you stick like that. So you keep doing that round and round until it's, so you keep doing that. So you stick it round and round. So after you stick it, then you place this bag on the side because the drainage should be going this side. So after having done that, Mr. Mwewa, thank you very much for allowing me to do the procedure. So you should avoid certain foods like boiled eggs because they'll be forming gas and it will be very uncomfortable for you. And then foods also like cabbage, beans, such foods, but you can drink water. And then if it's in shima, it has to be very, very soft. And prefer, you can prefer, maybe if you can prefer porridge, you can eat porridge. So at least you can give IEC. And then if in case the bag comes out, they can always call on you to come and remove it. So if they can call you, meaning you have to be ready. Okay, because this colostomy will be very active very soon. So you have to be ready to assist in changing the bag. So thank you very much for viewing. Have a pleasant day, and for any questions, there'll be that comment space where you can just slot in your question or your contribution. Thank you very much for watching.